Hello, everybody. This is Margareta Harris welcoming you to a global press conference focusing on the recent trip to Lebanon and Afghanistan, led by our WHO Director General, Dr. Tedros Adhanom Ghebreyesus, and our Regional Director for the Eastern Mediterranean region, Dr. Ahmed Al-Mandari. Speaking today will be Dr. Tedros Adhanom Ghebreyesus and also Dr. Ahmed Al-Mandari, but they will be joined by Dr. Iman Shankiti, our WHO representative in Lebanon, and also Dr. Luo Dapeng, our representative in Afghanistan. As usual, we also have experts to discuss the global COVID-19 situation, so we will take questions on COVID-19 as well. And we also have Dr. Ibrahim Assosi Fall, our Assistant Director General for Emergencies Response, who is covering all these many issues that we are looking at, particularly in the Eastern Mediterranean. The experts on COVID available today are Dr. Maria Van Kerkhove, our technical lead on COVID-19, and Dr. Mike Ryan, Director of our Emergencies Program, Executive Director of our Emergencies Program. You've been waiting, as ever. We also have a team providing simultaneous translation in the 6 official UN languages, and I thank you all, the translators, in advance. You've been waiting patiently to hear from our high-level team, so I will now hand over to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you. Thank you so much, Margaret. Good morning, good afternoon, and good evening. Yesterday, I returned to Geneva after a trip to Lebanon and Afghanistan with Dr. Ahmed Al-Mandari, WHO's Regional Director for the Eastern Mediterranean. Our objective in both countries was to see for ourselves the health challenges communities are facing and to engage with senior political leaders to assess how best WHO can support health systems that are under severe strain. In Lebanon, we had the opportunity to meet with the President, the Prime Minister, the President of the Parliament, the Minister of Foreign Affairs, and the Minister of Health. We discussed how best WHO can support Lebanon and the importance of putting public health at the center of national political dialogue and development. I must say I'm deeply concerned by the impact of the current crisis on the health and well-being of Lebanon's people and the risks we face of losing the health gains that Lebanon had made over the last decades. The deadly combination of the political and financial crisis, last year's explosion at Beirut port, and the COVID-19 pandemic are having devastating consequences for the health of Lebanon's people. There is a serious shortage of supplies, medical equipment, fuel, and electricity. 2,000 medical doctors and 1,500 registered nurses have left the country, and 600 private pharmacies have closed. WHO continues to work to support the health system and the delivery of essential services and supplies. For example, last year's explosion at Beirut port completely destroyed a warehouse used to store essential medicines. With the support of the European Union, Kuwait, and Japan, WHO has managed not only to rehabilitate the warehouse, but also to increase its capacity by 5 times. In Afghanistan, we met with senior members of the Taliban leadership, including the interim Prime Minister. I believe that engaging the Taliban leadership is essential if we are to support the people of Afghanistan. Over the past 20 years, significant health gains have been made in Afghanistan in reducing maternal and child mortality, moving toward polio eradication, and more. Those gains are now at severe risk, with the country's health system on the brink of collapse. There has been a surge in cases of measles and diarrhea. Almost 50% of children are at risk of malnutrition. The resurgence of polio is a major risk, and 2.1 million doses of COVID-19 vaccine remain unused. Unless urgent action is taken, Afghanistan faces an imminent humanitarian catastrophe. Health workers are leaving, creating a brain drain that will have consequences for years to come. We visited a hospital where we met some nurses who have stayed. My heart broke when they told me they have not been paid in 3 months. But they said they would continue to serve their patients. Education is essential for protecting and promoting health in all countries, both in terms of health literacy and for building the health workforce. The Taliban leadership has announced that primary schools are open for boys and girls, and that they are preparing to open high schools to girls. In our discussions, we offered to support that process and speed it up in partnership with other UN agencies. The focus of our efforts now is to support and sustain the Sahat Mandi project, which is the backbone of Afghanistan's health system, providing care for millions of people through 2,300 health facilities, including in remote areas. But a funding pause by major donors, only 17% of these facilities are fully functional, and 2/3 have stockouts of essential medicines. As a stopgap measure, the United Nations Central Emergency Response Fund and the Global Fund to Fight AIDS, Tuberculosis, and Malaria are financing WHO and our partners to ensure continuity of health services for the next 3 months. But this is simply not enough. WHO is calling on our international donors to rapidly recommit to finance Sahat Mandi, as they have done for almost 2 decades. We simply cannot abruptly halt support for life-saving health services for millions of Afghans at a time when they're most vulnerable. We also need a reliable supply chain to be established urgently. WHO was the first agency to airlift essential medicines and supplies into Afghanistan, and we have now shipped more than 170 metric tons of medical supplies. But we need the support of the international community to establish a regular and reliable way of getting supplies in. And I would like to use this opportunity to thank Qatar for its support in the transportation of the supplies and also in arranging our travel to Afghanistan. What we saw in Lebanon and Afghanistan reminded me of why the world needs WHO and of the incredible job our people are doing in incredibly difficult circumstances. As I said, I was joined on my trip by Dr. Ahmed Al-Mandari, WHO's Regional Director for the Eastern Mediterranean. And I'm very pleased that he could join us for today's briefing. My brother Ahmed, welcome, and you have the floor.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and good morning. Thank you very much, dear brother, for giving me the chance to come together today and share a briefing with our national, regional, and global media, which is timely and a very important feedback for our dear colleagues, to have about that important visit. And I'd like, before I give my remarks, in fact, to express on behalf of EMRO, regional office, country offices, as well as member states, our sincere thanks and appreciations to you, dear brother, for Dr. Thomas, for giving us the time to come and visit these countries in a very difficult and very tight schedule for you there with so many competing priorities. But as usual, you put WHO, you put its member states and our dear citizens in every region, not only in EMRO, the full support at any time we approach you. So it is really appreciated, Dr. Tedros, for that. If you don't mind, I'm going to give my remarks in Arabic. So I'll start giving it. بسم الله الرحمن الرحيم. يضم إقليم شرق المتوسط الذي لي الشرف أن أمثله 22 بلدا في شمال أفريقيا وأنحاء الشرق الأوسط، كما يمتد لأجزاء من جنوب آسيا. وقد عانى الإقليم من أزمات متعددة حتى قبل جائحة كوفيد-19، وهو موطن للأسف الشديد لما يبلغ من 43% من الأشخاص الذين يحتاجون إلى مساعدات إنسانية على مستوى العالم، كما يعد مصدرا لنحو 64% من اللاجئين في العالم. ونواجه 10 طوارئ إنسانية واسعة النطاق في سائر الإقليم، إضافة إلى جائحة كوفيد-19 و5 فاشيات وكوارث طبيعية أخرى، والتي تشكل مجتمعة احتياجات صحية هائلة وتتطلب عملا إنسانيا ضخما. وتعد معظم هذه الأزمات الإنسانية طويلة الأمد، حيث يمتد بعضها على مدى عقود، مثل أفغانستان والصومال. وتتسم تلك الأزمات بسنوات من الصراع المستمر والاضطرابات الاجتماعية والسياسية التي عصفت بحياة الملايين. ومع ظهور جائحة كوفيد-19 ازداد الوضع تفاقما، فقد أدت الجائحة إلى إجهاد النظم الصحية الهشة بالفعل، وهي بالنسبة لكثير من الناس مجرد تهديد آخر.
By the recent changes in recent years, we have major challenges combining to exacerbate the situation.
Again, because the global journalists who don't speak Arabic missed. I'm so sorry. Apologize for this. It was a technical problem. Would you be able to start over again in Arabic?
My pleasure, sure. And if you face any difficulties, I'll be happy to give it in English as well. So
But your Arabic is so lovely.
So shall I do it in Arabic?
Yes, please.
Sure.
The Emro region, which I have the honor of leading, comprises 22 member states in North Africa and adjacent regions in Asia. The region has faced several problems even before the advent of COVID-19. We in our region have 43% of the population in need of humanitarian assistance. The country plays host to 64% of the refugee population in the world. We have 10 major crises in addition to COVID-19. We have natural disasters. Altogether, they require us to provide major health services and an effort of great magnitudes. We believe that situations in Afghanistan and Somalia would require decades of help and assistance. The region continues to be plagued by major issues that are affecting the lives of people. With the advent of COVID-19, the situation became even exacerbated, and the vulnerability of a population is there to be seen. And we are faced with several threats whereby we need to deal with internal displacement, famine, morbidity, conflict, and poverty. Last week, I had the opportunity to travel with my brother Tedros to visit 2 countries in the region whereby the problems are on the rise every day. We have noticed that in Lebanon and Afghanistan, the health services are on the verge of collapse. There are major pressures that are facing these services, and people finding it difficult to get basic needs. Doctors in both countries have made it clear to us that the lack of supplies, especially medicines, are dire, and they have major and difficult decisions to make in dealing which patients they have to give priority. Pharmacies, depots are running short of stockpiles. In the Lebanon, The crash of the local currency has meant that health workers are only earning a fraction of what they used to earn in terms of purchase power. In Afghanistan, a large number of health workers are yet to receive their salaries, which makes it difficult for them to get to work, even to pay transport. Therefore, this situation is not conducive to improving the services when there are huge pressures to be dealt with. The economic situation in the Lebanon and the security situation in Afghanistan are leading to major losses. In Lebanon, the fuel shortages are having their impact on the health sector, and as a result, there is a shortage of electricity, and without electricity, health services cannot be provided. And sometimes life-saving services are affected. Prices have skyrocketed, and the situation is getting dire by the day. A large number of the population live below the line of poverty, and this means that the probability of infections and disease are on the rise too. In Afghanistan now, we are faced with the possibility of not being able to finance one of the biggest health services. In some areas of Afghanistan, we have heard of large numbers of deaths of women bearing children or young children because of the lack of such basic services. And COVID-19 adds another layer to the panoply of issues that we need to deal with. It is astonishing how some countries do not see what's COVID-19 through the same perspective, and this can only lead to fears of an increase in infections, a new wave of propagation of the virus in both countries. During our visit, we heard some painful stories. However, these painful stories have made us more determined than before to expand our services and to deal with the situation. We have an opportunity in both countries. Leaders in both countries that we met with have expressed their desire to ensure the safety of their population and their willingness to help us expand the scope of services that we can provide. We have received commitments from leaders in both countries and other stakeholders in playing a role. However, we need greater commitment on the part of donor parties. In Afghanistan, the halting of financing Dahat Mandi, which covers dozens of facilities, is the backbone of providing services in that country. Therefore, I would appeal to all donor countries and donor bodies to continue to provide support, because they will help save the lives of hundreds of thousands, if not millions, of Afghani citizens. That's the way we can provide humanitarian assistance. We stand ready to provide the assistance on condition that we have the finances for such assistance. During our meetings over the past week, we made one clear message, that in spite of the changes in the leaderships in both countries, the people who are in dire need of these services are the same, and they need our help. We will continue to provide the assistance vigorously. We will make sure that every single individual will receive health services equitably. Health for all. We will not let the people of Lebanon or Afghanistan down, and we will not hesitate to help any population anywhere in the world. May God bless you. Thank you.
Thank you. Thank you so much, my brother Ahmed. And thank you for everything that you and your staff are doing to protect and promote the health of the people of Lebanon and Afghanistan at this very critical time. And now I would like to also invite the WR of Lebanon, our WR of Lebanon, Dr. Iman Shankiti. Iman, you have the floor.
Thank you, DG. Thank you, RD. We had the privilege of having you here with us for 2 days. We are really very happy about it. Dear colleagues of the media, the current complex crisis has heavily impacted the health system in Lebanon. Decreased availability, affordability, accessibility, and quality of healthcare in general, and threatening the health system sustainability and resilience. As a result of the severe financial and fuel crisis, most hospitals are currently operating at 50% capacity. Only life-saving hospital interventions are prioritized. Primary healthcare centers are rationing on fuel consumption by reducing opening hours, while more than 600 private pharmacies are temporarily closed. Moreover, it is estimated that around 15 to 17% out of a total 20,000 registered nurses have left the country over the past 12 months, while more than 1,000 nurses have been laid off since last year. Also, around 40% of medical doctors and mainly specialists have permanently emigrated or are working on part-time basis outside the country. It is estimated that the Ministry of Health will need to cover healthcare for at least 70% of the population, compared to 48% prior to the current crisis, as unemployment and poverty are rising. The government fiscal and financial situation resulted in unpaid bills to both private and public health sector, threatening the sustainability of health services and increasing health financial hardship on the vulnerable population. WHO will continue to support the Ministry of Health and, of course, the people of Lebanon by filling acute gaps in medications. And I would like to indicate that so far, more than 550,000 patients are receiving acute and chronic medications and treatments. Maintaining access to essential healthcare, and this has been done during COVID through its support, through WHO support to 12 public hospitals with equipment, supplies, the recruitment of nurses, more than 620 nurses were recruited, training, reimbursement of ICU care for uninsured vulnerable patients, and contributing towards the doubling of the public sector hospitalization capacity. Also, bridging humanitarian support towards sustainable development, including the integration of primary healthcare packages. And last but not least, we adopted an innovative approach during COVID response, where selected major public hospitals were twinned with private academic hospitals aiming at improving and standardizing COVID-19 critical care practices. Last but not least, we remain committed to continue our immediate life-saving work in Lebanon, while also planning for longer-term strategies for health. We count on the support of all stakeholders so that together we can take Lebanon from its current crisis to a future where all Lebanese can enjoy health as a basic right. Thank you.
Thank you. Thank you so much, Iman. And now I would like to introduce Dr. Lo Dapeng, WHO representative in Afghanistan. Lo, you have the floor.
Thank you, DG. Good morning, good afternoon, good evening to everyone. WHO remains on the ground, is scaling up the efforts to continue response to the escalating health humanitarian crisis unfolding across Afghanistan. Country already fragile health system is overwhelming. The impact of course of funding of Sahamandi project are already being felt. WHO call on international donors to repeatedly recommend to finance the Sahamandi, also has been done for almost 2 decades. In recent weeks, access to health care has significantly declined for hundreds of thousands of some most vulnerable Afghans. They have already surged in case of measles, diarrhea. Almost 50% of children are at risk of malnutrition. A resurgence of polio is a major concern. An element of COVID-19 response has been declined, and 2.1 million doses of COVID-19 remain unused. There are urgent need to ensure those doses are utilized before expiring. According to our assessment, only 17% of health facilities supported by Sahamandi remain fully functional. Two-thirds are experiencing stock out of essential medicines. Without immediate action, they are at risk of closure. We are coordinating with donors to find an alternative funding mechanism to sustain health facilities supported by the project to avoid increased disease or deaths. We are also working with partners to find a short-term solution to fund support the Sahamandi supported project so that life-saving healthcare can continue. On 23rd of September, Afghan has reported 150,929 cases of COVID-19, 7,194 deaths due to interruption of the COVID-19 surveillance, significant decline in testing because of recent insecurity. We know there is underreporting of the cases. WHO is boosting COVID-19 testing capacity in the country. Recently, we have airlifted 50,000 COVID-19 tests. That is being distributed to 32 provinces across the country. Some 150,000 more COVID-19 tests are being in the pipeline, will be delivered in the next 3 to 9 months. WHO also established new testing sites in Newell province recently, and 10 more laboratories are planned. Only one case of white polio reported so far this year, compared 56 in 2020. We are in an extraordinary opportunity to eradicate polio in Afghanistan. Together with partners, WHO is ready to implement door-to-door polio vaccination campaign across the country. Given the measles outbreak are also spreading, the polio program plan to deliver integrated campaign, including measles or COVID-19 vaccination. The escalation of health needs are continued strength health facilities, which remain short on essential supply. WHO operation and logistics team are working around the clock to deliver supply across the country to fill in the shortage. WHO is the first humanitarian agency to deliver medicines and medical supply in August after disruption of Kabul airport. Since then, we have airlifted more than 170 metric tons of life-saving supply, and there are explore options to expedite further shipment into the country. We continue to support 130 trauma center facilities and 67 blood banks, a plan assuming a capacity of training for health staff. Health women and children in country depend on availability of female doctors, nurses, and midwifery. We call for a safe and productive working environment for female health workers and for their ongoing education and training. We affirm WHO support Afghanistan, and we will continue to deliver a coordinated health response throughout more than 50 partners. Thank you.
Thank you, Dr. Dapeng. Now, Margaret, back to you.
Thank you, Dr. Tedros and RD and the WRs for that fascinating and rich description of the issues. So I will now open the floor to questions. I'll let journalists know as most of you know you raise your hands in the queue, but we also have taken a special approach today because of the logistics involved, and the extraordinary team in EMRO have already collected some questions. So the questions will be asked on behalf of the different media outlets that have indicated their questions. So the first question will be asked by Ms. Mona Yassim on behalf of Al Arabiya and Al Masa. Mona, over to you to ask the question.
شكرا مارغريت. السؤال يقول: ما تقييم منظمة الصحة العالمية للوضع الوبائي والصحي في كل من لبنان وأفغانستان، وكيف يمكن الاستجابة للصعوبات التي
How can we respond to difficulties dealt with by these two populations? Do you have any mechanisms in order to deal with these obstacles? As you mentioned, Margaret, that is Al Arabiya's question. Thank you.
البدء بالإجابة. نبدأ ب WR لبنان. تفضلي دكتورة إيمان شنقيطي.
Thank you, Mona.
Dr. Shafiki.
Important question. First of all, we would like to say that Lebanon is doing actually well in the area of COVID. Maybe we start with some of the successes, specifically in the vaccination. We have a vaccination rate or coverage more than 30%, while the global rate is 40%. By the end of the year. We expect we will supersede that number. Additionally, if we look at number of cases in the country, we can see that it is plateauing. It is always between 1,000, a little bit more, a little bit less, while the case fatality rate is around 1.34%. Additionally, the positivity rate is below 5%. So what I'm trying to say is that currently, probably there are several factors that are contributing to the achievements, and one of them is that the vaccination plan it was very effective, and it targeted the most risky and the most vulnerable people, specifically the elderly, those that have any pre-existing conditions, and the healthcare workers. So if we look also at, if we dissect the cases that are currently in the hospitals, we can say that more than 85% of these cases are non-vaccinated or have received only one dose, or have not had the 14 days grace period between the second dose to ensure full immunity, which also gives us an indication that the vaccines are working well. So in terms of COVID, I think Lebanon is doing well in that area. And specifically, if we look at hospital capacity rates ranging between 25 and 35% for regular and ICU beds. What is WHO doing? Definitely, we have been supporting from the beginning, and we continue to support, specifically during this very difficult situation. WHO is working also part of the whole UN approach towards addressing COVID, but also addressing other challenges. So many of the challenges, whether it is human resources, whether it's fuel, whether it is medications, there has been specific support to different hospitals to ensure that the system can operate and can respond as efficiently and timely as needed. So I think this is my answer in summary. Thank you.
شكرا دكتورة إيمان، وأنتقل لدكتور لو WR أفغانستان. دكتور.
Thank you very much, Ms. Iman. I give the floor to the representative of Afghanistan.
Thank you for the question. Also, we just briefly said the Afghanistan health system on the brink of the collapse because of first fund for the Sahmandi. And WHO actually played a vital role in terms of advocates continuous found a short-term solution and long-term solution with partners. WHO is vital to ensure the service to be in place. WHO is vital humanitarian and development partner, remain in the front line for response to current crisis. And WHO leading the health cluster, which has been most operational. For instance, recently we delivered 170 tons of supply, including emergency kits, essential drugs, chloride kits, COVID-19 diagnosis kits, tests, and others. WHO also leading a coordinating with health actors across country, including Minister of Public Health, for more than 50 organizations. WHO also work on scale-up trauma program in view of the current situation. We currently support 130 trauma centers, 67 blood banks across country, and we're planning conduct training for health workers, continue provide life-saving supplies.
شكرا دكتور لو. تعليق أخير من دكتور أحمد المنظري، تفضل.
Thank you, Mr. Loon. Dr. Ahmad Mandari, any conclusions?
Thank you for your remarks. In fact, just I'd like to just give my 2 comments on the feedback or the answers given by my dear WRs. The first remark is that, re-emphasize on the role of WHO there on the ground. Based on that visit, as my dear brother Dr. Tedros have mentioned, we have seen first-hand experience the huge list and long list of challenges in both countries. By all means, challenges in terms of health systems, that it is facing, or challenges on types of health challenges, his health problem challenges that the communities and individuals are facing. So WHO is exploring every opportunity to make sure that we are working hand in hand with the health authorities in both countries, as well as with partners, donors, and everyone, even with individual community members, to make sure that we continue saving lives, promoting health, and serving the vulnerables. The second point is my request, please, to donors and partners. Please continue supporting us. Continue working with us in serving the humanity, in saving the lives of the children, the mothers, the men, the women, the elderly. Reports may talk, reports may give numbers, but when it comes into saving one life, we all have that satisfying feeling when we see the smile in the child after being going through a very bad experience of malnutrition and all related health or illnesses that will bring due to the malnutrition and reduced immunity. That is the most significant, important, satisfying feeling when we see that smile in the face of the child and the face of his or her parents. So please, I urge you to continue supporting us, and we assure you that we are fully committed as a WHO to work on the ground, by all means, exploring every opportunity, and continue collaborating with everyone, helping us in serving the humanity and saving lives in both countries and other countries in need of our service. That's all. Thank you, Madam.
Thank you, Dr. Ahmed, and back to you, Margaret.
Thank you so much, Mona. We'll now take a question from a journalist in Geneva. That's, Jenny Lee. I'm not sure that you actually are in Geneva, but Jenny Lee from DevEx. Jenny, can you unmute yourself and ask your question?
Hi, thank you so much for taking my question. Yesterday, the UN humanitarian chief released $45 million from the UN SURF to keep healthcare facilities running in Afghanistan. Can I just get a sense of how helpful will that be? Is that going to increase the number of functioning health facilities, or is that just to maintain this 17% currently fully functioning? And just another thing on because this is going to run for at least, I think, until the end of 2021. I wonder if there are any indications of donors resuming funding, perhaps through alternative financing mechanisms, the UN being an intermediary to course through the funding to NGOs. Thank you so much.
Thank you, Jenny Lee. I think this is probably a question for the regional director to start. And then, Dr. Sosa, you'd like to answer first here, or we go to the regional director first?
You can start with the regional director, and I will complement. Thank you.
Adi, over to you to answer that question.
Thank you very much. Thank you, and thank you for this important question. In fact, the funds that you have just mentioned, I have had a call yesterday with the regional director, UNICEF, and as you all heard, that this will go to WHO and UNICEF working together in serving continuing the service of a good number of healthcare facilities there in Afghanistan. Our WR dabbing with the UNICEF representative are also discussing this further, even weeks before, and they will continue, sharing thoughts and ideas on how best to make sure that the funds given will be used and utilized in a very efficient manner, and make sure that the healthcare facilities will continue providing the service until the issue of funds will be resolved for the whole project of Sihat Mandi. So that's all from my side, and back to you, Sose. And I don't know if you don't mind, just to hear from Dabbing also, our WR there, for any further details if needed. Thank you very much. Back to you, Margaret.
Thank you, Dr. Ahmed and Margaret. First of all, we would like to welcome the decision from Martin Griffiths, the USG for Humanitarian Affairs Emergency Relief, to provide the $45 million for life-saving intervention. This will be extremely helpful for the next 3 months because we'll be able to cover some life-saving intervention for 3 months. And in addition to that, WHO has released $3.5 million from the emergency fund to be able to airlift the 170 tons of medical supply we talked about. This is just a bridge. We need to make sure that we have the commitment from donors to continue supporting WHO, UNICEF, and all the partners we are working with. We need to highlight that we are working with more than 50 organizations, and in the health cluster, we have 130 organizations working with us. So the fund we receive, both WHO and UNICEF, will help to really support all these NGOs and local civil society organizations providing primary health care. And as you rightly said, right now only 70% of the 2,300 health facilities funded under the Third Money project are functioning. So having the bridge for 3 months is excellent, but we need more commitment from donors. Thank you.
And I think WR Afghanistan, Dr. Low, you're coming in now.
Thank you, and thank you also RD and ASG. Mentioned WHO welcomed the decision of the SURF fund to release $45 million to support also short-term measure to function the Sahamandi project. As Assistant Director General just say, this fund may provide support for the Sahamandi project, 2,300 health facility up to 3 months. But this will be only short-term solution, and but we do need the partner real commitment for long-term solution, and to ensure the basic public health service, to essential health services or Sahamani project, which is the backbone of the health system, to be functional. So we were not at risk of loss gain we have done last 20 years work. Yes, please, we need our donor continue for the long-term solution to support essential service, which is funded by the Sahamandi project. Thank you.
Thank you very much. So for the next question, we'll go over to Mona again. This is a question from the Jordanian news agency. So Mona, over to you.
شكرا مارغريت. السؤال يتعلق بجائحة كوفيد-19 ويقول ما توقعات.
Thank you. My question is about the COVID-19 pandemic. What is your assessment of the situation and the prospects for countries that have just opened their borders? Will there be a new wave? That is the question from the Jordanian agency. Thank you.
من تقترحون?
Dr. Marina replies, who would like to answer this question?
Margaret?
Thank you, Mona. I think this is a question for Dr. Maria Van Kerkhove, and she looks ready to answer it.
Thank you very much for the question. I'll begin, but others may want to come in. The global situation is quite dynamic. We are still seeing a large amount of circulation at a global level, although we are seeing some declining trends in cases over the last 2 weeks and declines in the numbers of deaths reported at a global level over the last month. But there still is quite a high level of transmission. It varies by region, it varies by country. As with regards to travel and the movement of individuals, over time, over the course of this pandemic, there have been a lot of risk mitigation measures that have been put in place to minimize the risk of potential spread of this virus around the world. We know the virus travels in people, but there are many ways in which we can reduce that spread through in the origin country, through the point of travel, and also in the destination of countries. Our recommendation, of course, is to focus on essential travel, and there are many people around the world that do need to move, and others may want to come in on this in the current context, but there are ways in which travel can be, the risk during travel can be minimized through masking, through tests, through vaccination, of course, and through other measures in place, again, in the point of origin, through the point of travel, and at the end. What we do want to see is people who have to travel not be stigmatized because of that need to travel. I do also want to point out, in the context of the global situation, we are seeing much movement, in terms of tourism, in terms of individuals who are traveling for pleasure. And we saw last year, for example, that the virus can move in people. Again, 21 months in, we know what works in terms of reducing the spread. We know what works in terms of saving lives, and it's a comprehensive approach there. But having said that, with regards to travel, there's no zero risk, but there's a lot that we can do to minimize the potential spread.
Thank you, Dr. Maria, and back to you, Margaret.
Thank you, Mona. Looking around the room, I don't think anyone is going to add here. Is there anything that the RD would like to add on this subject in relation to the countries in the region?
Thank you, Margaret. Thank you. Nothing specific, in fact, but I'm just repeating the same message that we used to send to health authorities, the ministers, different health authorities in each individual country to keep sticking, to the well-known health measures that have been supporting us for the last 1 year and a half in fighting this pandemic and controlling its spread. Strengthening the healthcare systems, protecting our front liners, the healthcare providers, and making sure that health systems are fully supported by all other sectors in the same, government. Moving through the concept WHO have been introducing for almost, since the beginning of this pandemic, the whole of government and the whole of society, and also the collaboration between the different countries within the same region and different regions. And continuing the same message to the community and individuals in these communities, adhering to the public health measures as have been mentioned, by Anna Maria, and we are following it up on regular basis with different levels of authorities in these countries. So that's all from my side, Margaret. Thank you.
Thank you very much for that intervention. The next question goes to Musa in Geneva. Musa, you're from Al Almaya TV. Musa, please unmute yourself and ask your question.
Oui, vous m'entendez maintenant?
Can you hear me now?
Oui, on peut.
Yes, we hear you.
سؤالي سيد تدرس أولاً بعد.
My question will be asked in Arabic and is addressed to Dr. Tedros. After your visit to Lebanon, you were able to see the situation on the ground there. Do you plan to increase aid to Lebanon? Do you need to send a new message to the international community and to international donors to increase support for Lebanon? You spoke about support from Kuwait. How did Kuwait support Lebanon? What aid are you talking about here? Thank you.
So the question was to Dr. Tedros, asking about Lebanon and whether we will increase our aid and our support to Lebanon. Dr. Tedros, or would you like us to... Dr. Tedros.
Yeah, thank you so much. I think we had a press conference immediately after our trip to Lebanon, and the press conference we had from Beirut, and were able to explain the situation in Lebanon. As you know, it's a combination of many factors which is causing a serious upheaval and a very deeply concerning condition. And this is a combination of the political crisis and the financial meltdown 2 years ago, and then, of course, the explosion at the port last year. And also, on top of that, of course, like other countries, you have COVID. And especially now there is a new government, and hopefully there will be a solution for the political crisis. But the financial meltdown is really seriously felt at the, all over Lebanon. And the poverty rate has actually increased, and that affects the health condition of the Lebanese really seriously. When we had a meeting with the Prime Minister, even the Prime Minister told us that he couldn't find essential medicines from the market. And it's that serious. And fuel is another problem. And without fuel, you cannot run health institutions. But on top of that, health workers are leaving. Imagine a combination of lack of supplies, health workers leaving, no fuel even to run your health facilities. So Lebanon is in a very dire condition. And we have asked then, when we had the pressure in Beirut, for the international community to take Lebanon's situation very seriously and to give its support. So the support should be to address all the major challenges that Lebanon is facing, and it has to be as comprehensive as possible, and really something that's helpful to address the many challenges it's facing. So the international community, I think, should take Lebanon seriously and address the various problems Lebanon is facing. It will not be like one recommendation, this or that. We had a meeting, by the way, with the donors while we were still in Lebanon, and they understand that it's complex, and they have to really help in a very comprehensive way. Thank you.
Thank you very much, Dr. Tedros. We are running over time now, and I understand our colleagues in the African region will be beginning a presser as well. So we've got time for one more question, and that will go over to Al-Alam Al-Yom News, based in Cairo. It's over to you, Mona, to ask that question.
Thanks, Margaret. السؤال يقول: تحدثتم عن أزمة تمويل لجهود الصحة العالمية.
You talked about crisis. What can we do to overcome the lack of funding in the field of health? Thank you. That was the question from Mr. Hashem.
You would answer this question.
Under orders, starters orders. Thank you. I wish it wasn't the end of the press conference, because we could speak about this for quite a while. Dr. Tedros has spoken for years now about the chronic underinvestment in health systems and specifically in public health preparedness. The world is paying a heavy price for the lack of that preparedness now. But we have a unique opportunity in the coming months to recommit ourselves to funding health preparedness, funding primary health care, and putting in place the defence systems we need to protect us from microbes and to reduce the social inequities that lead to lack of access to health care. We currently spend around the world at least $2,000 billion a year in defence spending. Yet we can barely defend ourselves against a tiny microbe. I think it is time for the world to re-look at its priorities. We need to defend ourselves against climate change, defend ourselves against the horrific impacts of social inequity, defend ourselves against the impact of tiny microbes. And it is time for the world to have a really big conversation about what our priorities are. Dr. Tedros has welcomed and is very deeply engaged with the G20+ in looking at how we can finance public health and health preparedness in the coming years, also leading with member states in discussing the benefits of a new political compact, convention or treaty that will allow us to come together globally in order to put in place the governance mechanisms we need, the financing mechanisms we need, the systems and tools that we need going forward. All of that done in a spirit of equity. If we can achieve that, I think we can move forward. And this is not just for COVID, this is for influenza, this is for cholera, this is for meningitis, and this is for basic access to life-saving healthcare for women and girls and many others in the likes of Afghanistan. So it's a really good question. It will take a lot of discussion. What can citizens do? Please speak to your politicians, work within civil society. We need to shift our priorities on this planet. We live on a planet that's out of balance. We live in a biome that's under stress. And we live in societies where inequity and the risk of infectious disease is a constant threat. So the upcoming discussions of the G20 leaders, the upcoming World Health Summit in Berlin, the upcoming Special Assembly of the World Health Assembly, an extraordinary assembly at the end of November, beginning of December. These are extraordinary opportunities for us to come together at the global level and for you, the citizens of the world, to speak out and speak your priorities and tell your truth to power.
Thank you, Dr. Ryan, and back to you, Margaret.
Thank you, Mona. I understand that that WR Lebanon wanted to have a little ad on Kuwait financing as well. So we'll go to you, WR, for that, and then we'll go to final closing remarks.
Thank you, Margaret. I just felt that the question had the second part, which was not answered. So in terms of the support of Kuwait to Lebanon, I wanted to highlight 3 areas. First of all, the support to the national measles and polio campaign, which during this campaign, more than 730,000 children were vaccinated, and this was done during COVID. And the second support was in the beginning of the COVID pandemic, where we had managed to elevate and expand on testing and collection of samples at community level. And of course, the last but not least support, which was the expansion and the rebuilding of the Karantina warehouse, where during this work, we are able to expand the current capacity 5 times from its original capacity. I just wanted to highlight this. So thank you so much.
Thank you very much. I will now hand over to Dr. Tedros for final remarks.
Yeah, thank you, Margaret. Ahmed, would you like to say a few words maybe in closing before I close it?
Thank you, dear brother, my privilege. In fact, just I'd like to give 2 important points, that as we all know, the region is very dynamic. It has been moving into different stages and levels of emergencies, conflicts, instabilities, which ultimately affected different sectors, particularly the healthcare sector, which resulted into losing many lives and a lot of people suffering from health-related problems. However, WHO, as I said before, is standing very strong at the front lines to make sure that we will fulfill the spirit, the values, and the expectations of the GBW13 and the SDGs in general and our AMR vision. Added to that is the COVID-19 challenge, as you all have heard. So it is just, urging you, partners and donors, please to continue supporting UN in general, but specifically WHO. And here I'd like just to mention that we assure you, donors and partners, we will utilize every second and every pence that you provide us to make sure that we serve, as I said, the spirit and the values of the GBW13, the SDGs, and whatever frameworks. And we are using very innovative strategies to provide that support. I will not go into the detailed one, but for example, we have had oxygen shortage in Somalia last year, in which in fact it was exacerbated by the COVID-19. We lost many lives. But alhamdulillah, with this innovative thinking at WHO of it is 3 levels, with the partners and donors, we managed to get oxygen producing or generating stations using the solar system. And to me, this is one of the success stories for WHO in bringing innovation and creative thinking to utilize whatever funds, even if it is a small fund, to save lives. This is my last message. We are trying to do our level best to be creative and innovative in utilizing these funds and saving lives, inshallah. Thank you very much, dear brother, and back to you.
Thank you so much indeed. I think I fully agree with what you said, my brother. And maybe one thing I would like to add is to stress on Afghanistan. This is our second time after Beirut to speak about Lebanon, so Afghanistan may need more attention. As has been said earlier, $45 million is already allocated by the UN SERV, the UN OCHA, and this could be used as a bridge. But the needs, especially to sustain the 2,300 Sahat Mandi health facilities, is way bigger than this. So while appreciating this as a good start, but we need more support to sustain the Sahat Mandi 2,331 health facilities. As you know, only 17% of these facilities are now operational, and this money will not be enough to run those who are in a problem. So we need more support. And from our side, we're talking to donors who have paused their funding, like the World Bank, and there is some positive signal. And we're talking to other partners too. But we call on the international community to come to the rescue before the crisis becomes a full-blown crisis. Because as I said earlier, this is an imminent catastrophe unless we act as quickly as possible, and that starts from financing the Sahat Mandi and help the health system really run. And I said it in my speech, the sad part is in one of the facilities we have visited, because of the lack of funding, health professionals are working without pay. And the 3 young nurses, women, which we have met and discussed even at length, they haven't had any salary for the last 3 months, but their commitment and dedication to serve is amazing. And they said they will continue to serve, but one of the issues they raised, or the major problems, is lack of salary. I don't think they can work in that condition, or they can continue to work in that condition, and I hope the international community will take it seriously. And as my brother Ahmed said, even with government change, the people in both countries, Lebanon or Afghanistan, are the same. So it's just the same mothers and children who need our support, whoever comes. So, and health should continue, health services should continue at all times, whatever condition. So we ask for the commitment of the international community to support Afghanistan. Thank you. And we would like also to thank all the media who have joined us today, and look forward to seeing you in our upcoming pressers. Thank you.